You have 37.2 trillion cells in your body, and sometimes they become mutated and go rogue. This is the reality for about 300,000 women across the US who have been diagnosed with breast cancer this year. It started with a solitary lump in their breast, but the cancer cells migrated to distant parts of their body, and the bone is one of the most common sites of breast cancer metastasis. Once cancer cells invade the pelvis, spine, or ribs, the breast cancer is generally incurable. But how do cancer cells in the breast travel all the way into the bone? There is a complex, multi-step process of metastasis. Step 1. Tumor cells initiate local invasion out of the breast. Malignant cells undergo the epithelial to mesenchymal transition, a milestone in metastasis. They lose their epithelial characteristics and exhibit more mesenchymal morphology, where they are elongated and striated, no longer compact and circular like healthy cells. The cancer cell can then separate from the primary breast tumor. Step 2. The mesenchymal cell enters into blood circulation. Invadipodia are F-actin-rich plasma membrane protrusions out of the mesenchymal cell. They help the cancer cell become more malignant and migratory by releasing matrix metalloproteinases to locally lyse the tightly confined basement membrane. The tumor cell can then migrate through into the blood vessel. Step 3. It survives in circulation. Step 4. Extravasates into the bone pre-metastatic niche. 70% of advanced breast cancer cases involve metastasis to the bone, but why do cancer cells frequently invade and successfully grow in the bone? In 1889, Dr. Stephen Paget proposed the seed and soil hypothesis, where he said cancer cells are like seeds because they can only grow in certain fertile soil that meets their tumorigenic needs, and the bone is a perfect fertile soil for the cancer to thrive in. In healthy tissue, bone homeostasis is maintained by the coupling of bone formation by these osteoblasts and the bone resorption of osteoclasts. But once metastatic cells have invaded the bone niche, they initiate the vicious cycle of metastasis, which remodels the fertile soil and fatally disrupts the bone matrix homeostasis. The cancer cells produce the growth factor parathyroid-related peptide, which upregulates rank ligands that go on to bind and excessively signal the osteoclasts to overdegrade the bone. Meanwhile, stored calcium and transforming growth factor beta in the bone matrix are released and enhance cancer cell proliferation, establishing this vicious cycle. The cancer cells have colonized and expanded in the bone, and the final step of metastasis is complete. Metastasis is a hallmark of oncology, and advances in researching the bone metastatic microenvironment holds new and promising insights, engineering feats, and most importantly, cancer therapeutics.